Second segment, I'm pleased to have with us Brian Shankey, who's the Executive Director of the American Heart Association of Northern New England, and Peter Lancette, who's the CEO of Encompass Health and who is chair of the American Heart Association and Stroke Ball event that's coming up. And for people who might not be familiar with what Encompass Health is, one of the facilities that you run and you are responsible for is Fairlawn Hospital.
Correct. Thank you.
Good. And we're going to probably have you on a later date to talk about that. But we're here to talk about the Central Mass Heart and Stroke Ball that is coming up. And maybe, Brian, you could kind of start us off just a little bit about what the event does and how people might get involved.
Sure. Coming up on the 11th is the event. It's kind of a culminating thing. We have had a group of volunteers working on it for various months. And the idea is really to promote heart health. You know, the American Heart Association's almost been around for 100 years. Next year is their 100th anniversary nationally. And really since the beginning, we've had a mission to go out and improve lives throughout all our communities. And so the Heart Ball really is one of those moments where we can pull together the business community, pull together some of the medical professionals, and really have a celebration and an excitement factor about all the things that we do. And
the Heart Ball has been around for a while.
It has.
Central Mass Heart
Ball. It has, yeah. I think it's 15 plus years. So.
And you mentioned, you know, the intent of involving the medical sector here, and you know, we talk on the show about economic development and the importance of good jobs for the residents of the region. Healthcare is the biggest employer in the region, and when you delve into how and why people utilize healthcare and how and why how we can kind of control and curb costs, a lot of issues around the heart are part of that, and part of this effort with the event and your work year round is to educate people on that, correct?
For sure, yeah. Education is a big component of what we do, and you know, a lot of what heart health is isn't just the things that you think about with a heart attack or a stroke, although those things are major factors. A lot of it involves nutrition. It involves the education of CPR for people out there that when there's an emergency situation, they're knowledgeable and they can jump in and do, you know, and make a difference.
And that was seen very vividly by the country with the recent situation with the Buffalo Bills football player. If it had not been for that CPR training and having medical professionals or even volunteers, you know, he might not be with us today.
Yeah, for sure. Damar Hamlin, you know, is really fortunate, and he's opted. You may have heard he's opted to use his podium to help bring more awareness around the issue of CPR and education. So we're anticipating even more general people becoming educated because of that.
And Peter, as a healthcare professional, somebody who kind of often deals with the back end of people, you know, having cardiovascular issues, you know, why did you agree to serve as the chair?
Right, exactly, Tim. Thank you. I'm just entered my 30th year in healthcare, so I've been around quite some time. I started off in pre-hospital care, spent about 15, 20 years in the emergency department, and then moved up to the heart and vascular interventional labs. And now, you know, being at Fairlawn, we're dealing with the aftermath of a critical injury and helping people regain their functional capabilities. But as Brian said, you know, it's really time to start thinking about your health before you're sick. Mm-hmm. You know, proper nutrition, you know, looking at those modifiable risks that you can change, looking at your blood pressure, because, you know, once you're showing signs and symptoms, it's, you know, you're down a pathway that it's much more difficult to correct.
That's right. And you know, certainly it's probably a time to kind of re-emphasize that, not only because it's a very public situation where it can be utilized as a tool to educate people, but you know, people were pretty sedentary for much of the whole COVID lockdown, and people, you know, not maybe out and active in the way they were in the past. Important to kind of reinforce that.
Yeah, COVID had kind of a dramatic effect on heart health in particular, because a lot of things affect heart health, from sleep to stress, nutrition. You know, certainly the you know, people's personal lives were affected. The way that they interacted was affected. Some of their psychosocial things played into it, and so because of that, there was actually a decline in overall life expectancy nationally, which is something that we're very concerned about to get back on track.
And just to add on to that, and one of the bigger things with COVID is patients put off preventative health care. So they put off those wellness checks, they put off those blood pressure checks. So I think we're seeing that now, a culmination of events from multiple years of COVID, that the people that are coming into the hospitals are definitely much more sicker, just related to the delay in time during the COVID pandemic.
Yeah, you hear that pretty regularly to our healthcare professionals, who not only were asked, and Peter, we could do a whole show on your involvement running the hospital down at the DCU Center for UMass at the time, but we saw our healthcare professionals just stand tall to meet the need of the COVID crisis. But there's no break, because people now are coming in sicker. Hospital emergency rooms across the country, in many cases, are busier than ever. So there was not really a chance for healthcare professionals to catch their breath.
Exactly. There's definitely an increased volume, increase in acuity, and we're facing a staffing challenge. Right now, the COVID drove a lot of people from healthcare out of the profession, and it's really challenging to get that volume of healthcare professionals back into the bedside at this point.
Yeah, well, that's a big piece of what we're trying to do. At the chamber, as I mentioned, with healthcare being such a big employer in the region, part of our work is also on workforce development and working with our public schools, our vocational technical schools, and as well as our colleges and universities, to try to make sure as early as possible our young people realize about the incredible opportunities in these various fields. And one of the things too that you're trying to focus on too is, as we look at data to help us understand healthcare, keep people healthier, control costs, is when we look at zip codes, right? We see people in certain zip codes, oftentimes economically disadvantaged, are not as healthier. There's ways to kind of go and do that education. That's a piece of what you're doing here too, right?
Yeah, it's a major education piece, because in Massachusetts you have zip codes that are right next to each other, where life expectancy, because of a variety of factors, is 15 years, up to 15 years difference between people living in this zip code and living in this zip code. So making sure that when we're doing research and when we're promoting health, we're doing it in an equitable standpoint for all of our population is super important for us.
Right. And you must, 30 plus years, you saw that daily, right?
We absolutely did, and even under Dr. Dixon's leadership during the pandemic, we launched the mobile vaccine clinic through UMass and went out to a lot of those zip codes and provided vaccines in the patient's homes. Mm-hmm. So I mean, it was definitely bringing the care to the patient. Right,
and that probably is. There's some things good we've learned, and some things not good that we've learned from COVID. But that is one piece we're likely to see more of, right? Bringing healthcare to people where they're at.
Absolutely.
So some of the things that are happening relating to the ball, how can people get involved, attend? This isn't just a one-day event. You're working year-round. How can people get involved if they're interested?
Yeah, so they can reach out to us at heart.org/Massachusetts. That will show the information about this particular event, but it'll also have ways to contact us for getting involved on a year-round basis. And the event, again, is at Mechanics Hall, Saturday, February 11th. It's going to be a great time. Thank you, Peter, and all our volunteers who are really leading the charge for us.
And there are ways that people can volunteer in supporting this annual event, but also you have a heart, stroke, and walk as well.
We do. That's in June. That's going to be at Polar Park. Very exciting. Again, that's a great time. Companies form teams and individuals form teams. The community really gets together and rallies behind the cause of education and employee awareness with healthcare.
And just maybe we can end on that education piece, which you referenced, early in response to the Hamlin thing, situation. Some of the trainings and CPR. How people can learn more about that as well.
Yeah, they would have to contact us. We'd work with them if they can go on our heart.org website /Massachusetts. We'll get out the word and we'll work with them and their companies.
Great. Well, it was great to having you both with us. Best of luck with the event, and thanks for the work you do in supporting our healthcare professionals and keeping our communities safer and healthier.
Thank you very much.
Good. We're going to come back in just a moment and talk about little Division I sports, particularly Holy Cross College. Stay with us.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.